Hello, everybody. Welcome to the final installment of the HIMSS ePatient Summit. I'm Jason Johnson. I'm the president of HIMSS Northern California. Been really excited about the turnout for this ePatient Summit this year. Obviously, it was a difficult decision to make to go virtual, and it turned out to be one of the most successful events in chapter history. So thank you for all your support. It's really been great spending the last 6 weeks Thursday lunches with everybody, and I hope you got something out of the sessions. So today, we are joined by Uber Health and American Logistics, and they are going to talk about how they're reinventing non-emergent patient transportation. So with that, I will turn things over to Dan Trigub, head.
Awesome. Well, thank you so much for the introduction. Definitely want to thank the HIMSS Northern California chapter for having us today. So in a few minutes, I will share my screen, walk you through the presentation that we have. I think certainly I'm talking to you all here from the East Bay here in Northern California. Unprecedented times that we find ourselves in. I feel like that word unprecedented I've used now myself with my team far too much over the last couple of months. And it just feels like yesterday when we were thinking about should we go to HIMSS or not this year in Orlando. And then, certainly kind of the spiral happened from there. The event was canceled. We've been sheltering in place. And it's been, a very unique time in our history. That said, what I can't be more proud about is the impact that an organization like Uber can have, like an organization such as Uber Health can have in the world that we live in today. So with that, I want to get into our presentation and really touch on some of the great things that we're doing in the space around non-emergency medical transportation, along with some of our, along with Mike, who's one of our longstanding and great partners here at Uber Health. So real quick on myself. So my name is Dan. I lead the Uber Health team. I've been at Uber now for just over a year and a half. Prior to that, I worked at the other rideshare company. I was one of their first healthcare hires, and can probably confidently say I'm one of the only people who've helped build a healthcare business within two rideshare companies. Prior to that, I've spent a long time in healthcare, over a decade, done a variety of different things. I've also been a caretaker for my own grandparents. And a story that I always love to share about myself and that I'm proud about is I'm first generation American. My entire family, my parents, my sister immigrated to this country from the former Soviet Union. And my grandmother, who was in her early 90s, lived in an apartment by herself in New York City. The only time she would leave her apartment was maybe once a week when my father and I would come visit her from New Jersey and make that 45-minute trip to go see her. What I would argue is she was severely socially isolated. She lacked independence, and a big part of that was transportation. So imagine if I was able to order her a ride and know where she was during that trip. Imagine if her health plan was able to provide quality transportation to get her to her doctor's appointment, or imagine if her healthcare provider can order her a ride. And at the core of it, that is what non-emergency medical transportation is really about. It's about serving our most underserved populations, our elderly, low-income, at-risk populations, people such as my grandmother who was on Medicare, and really helping them access healthcare where before it is extremely difficult. We're joined here by Mike Dunne from American Logistics, who will give an overview of some of the things that they're doing with us. And finally, Matt from the Uber Health product team, who's really helped build a lot of the great technology and solutions that we have at Uber Health that we will get into a little bit in this discussion. And then real quick, we've been a proud partner of American Logistics for almost a year now as their preferred rideshare partner. And we've done over 1 million rides together for the health plans that American Logistics serves. And it's been a phenomenal partnership with a world-class team over there. And certainly Mike will go into some of the things that we're doing. So that said, I just want to be clear about what Uber Health is. I think sometimes it's some confusion, or, Dan, this sounds wonderful, but how many of our elderly have a smartphone? How many of them can actually even use Uber, which is a very fair question. So Uber Health is its own independent entity, part of Uber, the broader company. We're our own LLC, but with that, we have our own dedicated resources from a technology perspective and people perspective. And we have this platform, this web-based platform that allows any third party to order a ride on behalf of the people that they care for. So I'm a care manager at Baycare Hospital, which is a 10-hospital health system in Central Florida. I can go to the Uber Health dashboard and order a ride on behalf of my patient at the moment of discharge. And this platform is within a HIPAA secure infrastructure. And in addition to that, we also have APIs that our partners can take our world-class technology and embed it within any systems or solutions that they have. So going back to the Baycare example, Baycare actually uses Cerner as their EHR. And now we've taken our API, integrated it within Cerner, and that hospital administrator does not have to be on that swivel chair anymore. They don't have to be in Cerner and swivel over to the Uber Health dashboard. Now it can be done within their workflow within the EHR. So hopefully that gives you all some context of what we're doing. And one thing I just want to pause for a second. Please ask questions. I want to make this interactive. It's always difficult when I can't see you all, but please do ask questions, and we'll try our best to answer as many as we can. A little bit about American Logistics, an organization that's been around for over 20 years, a world-class leader in the non-emergency medical transportation management or broker space. And again, you'll hear more from Mike later on about that. And the key thing for us is partnerships. We live in a partnership-driven environment with healthcare. As a large health system that I do a lot of work with, sometimes reminds me every day, TTT, things take time. And unfortunately in healthcare, that's sometimes often the case, but we are here. Uber is here and will be here for a very long time. And we want to build these great partnerships as we've done with American Logistics and others. And that's really how we ensure our success. So with that, I want to dive into some specific slides, but I also want to take a pause for a second. Obviously with COVID-19, the world's been flipped upside down over the last couple months now, and certainly we'll continue to be in a very unique environment for the foreseeable future. You may have seen our campaign at Uber that we recently we leaned into, and a company that does 15 million rides a day. We actually did a big push to tell our customers, to tell those that use our platform globally in over 60 countries, that we need to stop. We need to pause for a second. And we need to, first move what matters in this environment, essential healthcare workers as an example, but we also need to stay home. And this was a message that we really pushed out there. And, it's a hard message, certainly for a company that's all about mobility. But in this world, in this environment, it's really important. With that, we also committed over 10 million rides and meal deliveries for free to our partners globally. And here's just some examples of some of the work we've done. We have a tremendous partnership with Pack Health. We saw one of their members for the services that they provide. Uber Health has been critical in this time to get them to their chemo treatment, where now they got to go further away. The local provider was not available, not able to see them, but they had to rely on Uber Health to still get them to that care. Now, so there's a lot of great work that we're doing in this world and adjusting our business to really be in line with the world that we find ourselves within. Another partnership that we're very proud about is working with Takeda. Takeda is one of the largest pharmaceutical companies in the world. And we recently announced a program of 25,000 free round trips to help those eligible to get to plasma centers and plasma collection centers to help donate in this environment, given that all the data is showing that those with plasma that can have a big impact for those that need it. Again, there's a lot of great things that we're doing with some of our partners in this environment. The other thing I'd also say is we just announced today some of our latest safety features. So I want to make sure that that doesn't get unnoticed. Uber has always been the leader around safety and security in rideshare. We set the bar. And what happens is a lot of other rideshare companies globally will follow us based on this leadership. We announced today that we have technology. For example, all our drivers have to take a facial recognition check when they sign in to be a driver on the Uber platform every day. And anytime they turn off from the platform and come back on, they got to do a facial recognition screen. We recently adjusted that technology to ensure now that they're wearing a face covering. So our technology has recently been updated to detect, do they have a face covering? We announced today in the US that we will require drivers and passengers to have face coverings. We will not let passengers sit in the front seat moving forward. They all have to be in the back seat, which is another thing we announced today. And we've also committed $50 million to protective equipment for our drivers. We've ensured that we've secured face masks for drivers, not conflicting with the healthcare supply chain, and really, again, making sure that we're doing everything we can to create a safe environment as best as we can in this world that we live in with COVID-19. So with that said, in terms of us as a company, I mentioned we're in close to 70 countries today, over 10,000 cities. Uber is far more than just moving people. We have our Eats business, which is one of the largest meal delivery platforms in the world. And we also think about healthcare, getting a hot, healthy meal to somebody in a food desert. We do think that's something that we can have an impact on. We have our Uber Freight business and Elevate as well. So there's a lot to Uber beyond just curb-to-curb ambulatory transportation. And here's some of the features that we have. Many of you who've probably taken an Uber before know about some of these things, but it's very important for the healthcare use case. Tracking of our trips from point A to point B, 24/7 support. We have a HIPAA. We have a team of support people that actually go through HIPAA training that take care of any issues with Uber Health rides, as an example. And then the other thing is the liability and safety when it comes to the insurance and the coverage that we provide on all our trips. Actually, my family is in the home care business here in the Bay Area, and as a home care business, there's always concern that a caregiver can't get to their appointment. The car breaks down, or they can't make it to their client. Well, now they can use Uber to get them to that appointment. And then the other thing is the concern or risk if a caregiver gets into an accident with a client. As a home care agency, you might not have the right coverage or insurance for that liability. Well, that's a burden that now you can take and offload to Uber Health through the things that we provide for our partners today. Now, when it comes to transportation and healthcare, the data is staggering. When we think about, first of all, just total spend in healthcare, over 7.7 trillion here in the US. And transportation is absolutely a barrier to care. It is a social determinant of health. Quality access to transportation is definitely an SDOH that many healthcare providers are thinking about, and one of the key barriers for those getting to care. So, we really took a second a couple of years ago when we launched Uber Health and said, we can do a lot more in the communities that we operate in, and healthcare and providing better access to healthcare has been a core tenet of that. So with that said, today we have over 1,000 partners leveraging this Uber Health platform. We work with health systems to organizations like American Logistics that we'll learn about more today. We work with Grand Rounds that has a platform for employee-sponsored healthcare benefits. And then we also work with large healthcare IT organizations and platforms like Cerner when it comes to electronic health record companies. So, we've been in market for a long time, and we're really looking to continue to grow and have an impact. I talked about the API that we have, and here is a perfect example of that integration with Cerner. For lack of better words, an EHR is big, large infrastructure. It's kind of that quote unquote big and boring infrastructure that exists in healthcare. And now that care manager can order a ride directly through our API integration into Cerner. And we'll certainly learn a little bit more about what our technology entails. The other thing is Uber does have today the largest network of wheelchair accessible vehicles of any rideshare provider. So in about a dozen cities today, you can leverage Uber Health as well as our consumer platform and request a wheelchair accessible vehicle. And then the other thing we have at Uber is something called Uber Assist. And Uber Assist is another class of drivers. They're drivers that are highly rated on the Uber platform. They have a certain type of vehicle, not too low to the ground, not too high. So egress and regress is easier for those that use Uber Assist. And then our drivers go through third-party training for door-to-door transportation. So Uber Assist is also available in over 40 markets, and that is available through the Uber Health platform in case there are higher levels of transport required of our partner. But I would note the vast majority of the rides we do today are curb-to-curb ambulatory transportation. So when we work with our partners, we never suggest Uber Health is going to be the end-all, be-all solution. It's going to be the only solution. However, for a large portion of the population, we think we can be the best solution. The other thing is, when we look at our competitors and where we stack up, Uber is a world-class platform today. We leverage that world-class platform to bring that into our operations here in the US and within healthcare. We see tremendous feedback from our partners relative to other alternatives or options that they might have. We have 24/7 support. We support well over 40 languages, and you'll see some of that when Matt jumps into the product. We do have multilingual support within Uber Health, and we leverage this coverage that we have globally, again, for our Uber Health business. A couple other areas I want to touch on, especially during COVID-19 and some of the stuff that we've seen, is it's beyond just moving patients. It's moving essential healthcare staff members as well within this environment. We're actually working with many health systems today, getting their clinicians, their doctors, their nurses to and from work every single day. We actually launched a product in India called Uber Medic. Some of you might not know this, but actually India shut down Uber during COVID-19 and would not allow us to operate. However, we worked with the government and we launched a product called Uber Medic, where our drivers had protective equipment, higher rated drivers, special vehicles, and we were transporting essential healthcare workers using this Uber Medic platform. Maimonides Medical Center here in the States is another one that we've been working with. And what we see is healthcare workers don't have to worry about driving a vehicle now and all the headaches that go with vehicle ownership. They don't have to worry about parking that car, and they don't have to worry about potentially getting a ticket. And the other great thing is they're more productive. They can sit in the back seat of an Uber, take notes, do phone calls. And we work with many organizations, even hospice agencies, where again, their caregivers are using us to get around. The other one, great example, is Adventist Healthcare, an organization that we've been doing a lot of work with over the last year or so plus, and really leveraging us to help them during this time of crisis, and not only their staff, but also the patients they serve that do still require to get to medical care that is urgent in this environment. MedStar, another organization we've been working with for a very long time. They saw tremendous results when they worked with us. There's been some good case studies published that we can share as a follow-up if anyone's interested. But we've seen healthcare providers allow their transportation budget to go a lot further with Uber Health. They've reduced missed appointments and no-shows, and we see higher NPS scores or higher patient satisfaction when they have access to Uber Health and rideshare versus other alternatives of transportation. So really good data supporting the efficacy and the reliability of the services that we're providing. So with that said, I am going to stop. I know I threw a mouthful at you. What I'm going to do now is pass it over to Matt on the Uber Health product team to quickly run through some of our product features. Matt?
Yep. Thanks, Dan, and thanks everyone for tuning in today. I'm Matt Yao, and I'm a product manager on the Uber Health team. I work with a really talented team of software engineers, designers, and data scientists, and we leverage Uber's core technologies across rider, driver, marketplace, maps, and safety teams, and then we're able to build additional features on top of that to address the unique needs of healthcare organizations and the patient riders that they serve. So next slide, please. Okay, so diving into what exactly we offer in our product suite, like Dan mentioned, we offer both a dashboard and an API solution. Both of these options have the full capability across the different options, and it really depends on what your use case is. So we see that some of our larger partners that might have thousands of rides per hour tend to prefer the API for its scalability. And then some of our smaller organizations prefer to use the dashboard because it's really easy to use and is ready to go out of the box. The one thing I'll point out is that the dashboard solution is web-based. So it operates in your browser and is fully functional whether you're on your desktop or your mobile phone. Next slide. So I'm going to talk about sort of the workflow once you've already signed up for Uber Health and you're ready to start booking your rides. So here we see the new ride form, and the organization is able to enter the rider's first and last name, their phone number, and then where they want the rider to get picked up and dropped off. And the reason why we ask for the phone number is because the rider experience is completely through SMS messages. When we think about accessibility and making sure that an organization's patients that they care for is able to use Uber Health, we want to make sure that the service is accessible to not just people that have a smartphone and an Uber app. So whether you have a normal phone that can receive SMS messages, or if you even have a phone that can't even receive SMS messages, we've built a solution for that. So next slide. Once you've entered the rider's information, then the organization has the option to select what type of ride they want to book. So we have two types of rides, scheduled and flexible. Within flexible, there's the immediate ride type, which is probably something that we're all pretty familiar with. So this is an on-demand ride. So when you think about Uber and pushing a button, getting a ride, that's what that is. We've also built the ability for the organization to schedule a ride in advance, which aligns to sort of how organizations think about their patients and appointments. We realize that a lot of organizations sort of have a schedule of when their patients will be coming in to the facility and when they'll be leaving. So we built that ability for them to set up those rides in advance so that they don't have to scramble in real time to set up those rides. Next slide. The other ride type that we have is flexible rides. And this is a really great solution that's unique to Uber Health. And it allows the rider to have full control over when their ride is actually going to take place. So the organization is able to select which date that ride is going to be set up for. So think of this as a clinic understanding that the rider is coming in that day for an appointment, but they might not know exactly when the rider is ready. So this is really great because the rider is in full control of when they want to book that ride, and they simply text the number 1 when they want that Uber driver to be dispatched, and then the driver is able to arrive and facilitate a seamless pickup that way. Next slide. So once you've already scheduled your rides, you're actually able to view and manage the scheduled rides that you've booked for in the future. So from here, you're able to immediately request a ride that's been set up, and you're able to make any modifications. And I know this mock-up only displays 3 rides, but we see that some of our organizations that may have dozens of rides scheduled, this is a really useful feature because they're able to view all of their rides that are set up to happen in the future. And the other thing is that Uber Health is really flexible in the way that organizations are able to use it. So what I mean by that is whether you're a smaller organization with just 1 employee managing the transportation for your patient riders, or you're a medical facility with multiple campuses, it might even be across multiple states, and you might have hundreds of employees managing Uber Health, you're able to do that on this dashboard. Next slide, please. So this is a really key feature with Uber Health and the technology that we've built. You're able to monitor these trips in real time from the time that the driver is dispatched. So on the dashboard, you're actually able to see the driver navigating to that pickup point. And then once they picked up that patient rider, you're able to track that progress. And we've seen really great results when it comes to reducing waste, fraud, and abuse. But this is also about safety. So we've seen that organizations that care for patients that tend to skew older and maybe less tech savvy, It's really crucial for the organization to make sure that the rider gets home safely because the organization is booking that ride on behalf of the patient. We also display additional information here like driver rating, name, and the price of that ride for transparency. Next slide. And lastly, when you're done booking these rides and maybe it's time to review them, you're able to look at all the past rides that have happened. We're very transparent with the pricing and the driver, and we also display the pickup and drop-off information from the time that it's set up. There's also a couple other actions that you can take. So you're able to book a return trip with the click of a button, and that basically flips the pickup and drop-off points. You can book the same exact trip with a click of a button. And we know that not every trip, goes well. Sometimes there's things that happen. Maybe a rider leaves an item behind. So we have the ability to get in touch with support and also go through our lost item flow. But we also know that some rides go really well, where a driver goes above and beyond and maybe helps a patient with their crutches or their walker and helps them get into that vehicle. In those instances, we want to give the organization the ability to show their appreciation, which is why we have that set tip feature. So I covered sort of the end-to-end workflow for an organization using Uber Health. Now I'm going to cover some of the recent feature launches that we've had, which we're really excited about. So the first one, I sort of alluded to this, is that the Uber Health dashboard is web-based, which means that it is fully functional for a desktop and a mobile phone. So we know that some organizations, they might have a front desk agent that's sort of tethered to that desk, which is great. But we know that other organizations, their personnel, that they might not, their primary responsibility isn't just to book, Uber Health rides. They're caring for patients, they're doing other things, and they're bouncing around from room to room. So in those instances, we've seen that they really prefer to use the health dashboard on their mobile phones. Next slide, please. This is a really great feature that I'm really excited about because I was formerly on the Uber Maps team. So many of you have probably taken an Uber trip to or from an airport, and airports are really complex. You have multiple terminals, multiple floors, and then once you're on that floor, there's multiple doors. We've taken the same technology that's built for core Uber rides and embedded that for Uber Health. So as a healthcare organization, you're able to get in touch with our team and select specifically which door or entrance you want to set your pickup point, and then apply additional instructions that will be sent to both the driver and the rider. And we've seen really great results with this because we use the latitude and longitude point, which is basically as precise as you can get, rather than just the address. So we've seen really great results on pickups when it comes to this feature. Another really exciting feature that we recently launched is direct driver messaging. So Uber is the only rideshare service that has the ability to do in-app messaging on the driver and rider side. So if you can put yourselves in the shoes of a driver, you're driving on the road and you're constantly having to glance to your phone. It's really important to have this messaging capability built in-app so that as a driver, you don't have to constantly switch between your messaging app and your rideshare app. So now we've given organizations the ability to send a note to that driver when they're setting up that ride. So in this instance, the organization is saying, hey, look for this rider wearing that red shirt. And we've seen great results on facilitating a seamless pickup. Another feature that we've recently launched is landline calling for riders that may not have a mobile phone, a smartphone, that can't receive SMS messages, and they don't have the Uber app. So when we think about accessibility and serving those underserved populations, this is really crucial because we know that a decent size of our patient rider base doesn't actually have a phone that can receive SMS messages. And using Twilio, we've built a way that the rider can receive the exact same information that we're conveying through those SMS messages so that they know when the driver has been dispatched and when they're arriving at the pickup location. And the last thing that I'll touch on is multi-language support. This is also going back to accessibility and making sure that we're meeting the needs of all of our patient riders. So although health is primarily based in the US, we know that not every rider is a native English speaker. And this is really core to making sure that they understand the messages that we're sending to them. So we built the ability for the organization to indicate what language they want those SMS messages in. And we're also rolling out the ability for that landline calling feature to be spoken in the language that they want. So I've sort of covered the end-to-end workflow of an organization using the Uber Health product, as well as some recent feature launches. Now I'm going to pass it over to Mike from American Logistics. They've been a great partner, and they've been leveraging the Uber Health API to its fullest capabilities. Over to you, Mike.
Thank you. So to start, I'd really like to thank Matt and Dan and the entire Uber Health team for their presentation and the incredible partnership that we've enjoyed. Utilizing our in-house technology platform and API connections, we've dispatched nearly 5 million rideshare trips. And our relationship with Uber is a key factor in delivering customer-centric transportation to our healthcare clients. So again, my name's Mike Dunne. I'm the Vice President of Healthcare and Transit for American Logistics, and I've been with the company for about 12 years now. So next slide, Dan. When you have a spare moment, we would invite you to visit grownemttogether.com. It's a short and simple video that depicts the Uber and American Logistics partnership. Now, American Logistics, we are a full-service NEMT management company, and in the healthcare space, our clients primarily consist of Medicaid and Medicare Advantage payers or managed care organizations. And we also contract with hospitals, facilities, and some providers. And in addition to healthcare, we partner with transit agencies to provide rides for the vulnerable ADA population that may have challenges using the existing mass transit options that are available to them. For some of our larger healthcare clients, we manage the delivery of thousands of rides each day, utilizing several transport modes such as mileage reimbursement, mass transit, ambulatory curb-to-curb with Uber, ambulatory door-to-door, wheelchair accessible vehicles, gurney, bariatric gurney, advanced life support, basic life support, and sometimes we're even called upon to coordinate air. So next slide, Dan. So usually when a healthcare organization decides to not manage their transportation project in-house, that's when we really hope that American Logistics can be considered as a potential partner. Depending on the size and the scope of any transportation project, managing NEMT can be very complex with a ton of moving parts. And we have years of experience deploying the right people, processes, partners, technology to handle all these complexities. From working with 834 eligibility files on a daily or an hourly basis to claims-based encounter management with CMS 1500 forms or 837P files, or even simple invoicing and reporting. We offer a tailored solution to match the needs of any of our unique clients. And as an NEMT management company, working with some large payers, we are familiar with fee-for-service cost models, capitated pricing arrangements, including utilization corridors, and we can actually help our customers evaluate, the pros and cons of each so they can make a good decision. In many cases, as a delegated downstream entity, we have to be experienced with all kinds of audits, required accreditations, CMS compliance standards, and a ton more. So we help organize and provide client access to relevant data that we can make available to nearly custom report and management dashboards in real time. Next slide.
Hey, Mike,
As I move over
Yeah,
to the
Dan.
next slide here, we're getting some great questions. I'm going to throw two at you and
No problem.
feel free to address when you think the time's right. So first question comes from, and I apologize if I'm not pronouncing it correctly, Yogesh, and he's asking, or she, it'd be great if you could maybe touch on reimbursements if applicable, unless you're already planning to discuss. And then the next question from Cheryl is, it would be great to talk about billing codes in particular. So Mike, I'll let you address as you see fit.
Yeah, no problem, Dan. So both great questions, and the honest answer is in both cases, we have to follow the lead of our client. So there are standard billing codes for all kinds of different trip modes, if you will. And although there is in general a standard set, some clients choose to use different codes. So during our startup process, we will work with our clients before we start transportation, and we'll get all the assigned codes for every mode, whether it be the pickup, the mileage code, the different modes, different service levels. And that's something that we work with our clients before we actually start. So same thing with reimbursement and how it's reimbursed, multiple ways to do that. And all of our clients seem to have a little bit of a unique way to do it. So that is something we do during the startup. So great questions. Going on, over the next few slides, just want to provide a high level view of the member experience and the life cycle of a ride. And hopefully this will generate some more questions as well. Not all health plan members or patients are alike. And part of our job is actually matching the unique needs of each member with the most appropriate mode of transportation available according to the guidelines that we follow from our health plan. So with Medicaid, for example, when mass transit and mileage reimbursement are not a good fit, different modes of direct transport need to be considered. And in general, for members that can walk or ambulate on their own and don't need any assistance, we'll primarily use Uber rideshare through our API connection. And I mentioned to date, we've dispatched nearly 5 million rideshare trips for health plan members and patients with no smartphone or app needed. And almost all of those trips have been booked through the phone into one of our 24/7 call centers. We actually use Uber whenever possible for all healthcare member populations, including the most vulnerable, as long as they can walk on their own and they can cognitively manage, the Uber experience. And we'll help make that decision with our customer service agents and the member, on the phone when they book trips. But because Uber is nearly everywhere, their incredibly prompt pickup times are extremely valuable for urgent and same-day ride requests. And then for all other modes of transport, we have to match the member and the patient needs with drivers that may exceed the capability of a standard Uber driver. As Dan mentioned earlier, they might not have Wave or Assist in all markets, which means that we still need to make sure that we have local qualified transportation companies that are contracted with us. They're part of our Safety Society network of NEMT transportation providers, and they're able to cover all modes of transport. Next slide. So like I said, in addition to Uber, we do contract with hundreds of these local transportation providers covering all modes needed. We have a nationwide team of local experts that work very closely with all of our provider partners in the field. And this close relationship ensures that the high standards of our clients are met and that the member experience is a positive one. Our teams proactively monitor the status of the local transportation markets. And if and when Uber ever does decide to deploy a fleet of self-driving vehicles, and one of our clients is ready to take that leap of faith, we will be right there ready to schedule and manage capacity of that autonomous fleet as well. So next slide, Ann.
Mike, as we move on to the next slide, I'm going to take another question real time here. And the question from Michael. The question is, what if a senior needs to visit a smaller provider that doesn't have a relationship with Uber Health? Can they initiate an Uber ride themselves that is sensitive to their situation, even if they don't have a smartphone? So I'll take that question real quick. And Michael, thanks for the question. So to step back for a second, Uber Health was really designed to allow those that care for people, whether a health plan or healthcare provider, to order rides on behalf of them. So, Uber Health is really a B2B enterprise solution. Now, that said, we know there's needs, especially of our aging population, where they do need to access Uber directly. So a couple of things on what we're doing on that front. First, we actually launched a call to ride feature, and we just launched this at Uber in Florida and Arizona. And we actually have an 800 phone number where someone who is elderly can call us over the phone and initiate the ride without needing a smartphone or an Uber account, and talk to a real operator. On a national level, we actually have a partnership with an organization called the Go Grandparent, which is a very similar model to what I just described. And we are their national preferred rideshare partner. And they're using Uber Health, where they allow for somebody to go to their website, create an account. A son or daughter can do that on behalf of mom or dad. And all mom and dad would have to do is call an 800 number to request a ride. So there are ways, and certainly, if they do have a smartphone and an Uber app, they certainly can use it directly. But we are absolutely thinking about how we can serve our 65 and older population with programs such as those that I described. So thanks for the question. Mike, back to you.
Yeah, no problem, Dan. And, piggybacking on it as well, if American Logistics, if we are contracted with the health plan to manage their entire transportation benefit, we do the same thing that Dan was talking about as well, where, the health plan will authorize certain people to book trips on behalf of those members. And as long as they're allowed to do that, American Logistics, we can accommodate that as well, either over the phone, website, or health plan specific mobile app that we create for them. So great question. So these next couple slides illustrate a simple workflow design for achieving, better member experience. On the left-hand side of number one, it represents a health plan or the client. And prior to the launch of any transportation project, that our teams will work with the healthcare client to establish all the rules or protocols that will be adhered to in order to achieve the desired outcomes from the specific benefit design for that unique population that they're going to be serving. Depending on our client's benefit design, the members, client staff, or authorized medical provider partners can request rides over the phone, or through a client branded web or mobile app that we make available as well. So next slide. Regardless of how or by who the ride requests originate, each trip booking method will utilize a streamlined process to make sure that each member is transported by the most appropriate mode of transportation and transportation provider available. So once the ride is scheduled, either on demand or in advance with the correct transportation provider, real-time ride tracking occurs through the American Logistics technologies like our direct API dispatch, integrations with Uber and other systems. We also have mobile driver apps and simple mobile text messaging solutions with GPS that enable us to track every trip regardless of what mode and what provider it is. So with the ability to manage all the rides in real time using GPS technologies, our operations teams, our clients, and their authorized medical provider partners, we can all make decisions using the most accurate and reliable ride data and information possible in real time. Customer experience is key when it comes to the healthcare member or the rider. And it's also really important that our healthcare clients have a positive and productive experience when working with American Logistics. So we have daily custom reports, dynamic dashboards, in-person joint operation meetings, and more. And all this is to ensure that the healthcare members have the highest probability of having a great experience. And in most cases, we believe that treatment begins with transportation. And when transportation benefits are designed and properly executed, the members are happier and they're more likely to actually enjoy better health outcomes as well. So next slide.
Mike, I'm going to interrupt you again, kind of rapid fire here. We're getting some really good questions. I'm going to try to do them quickly, and then feel free, Mike, when I'm done, to just add any more color. So here we go. Nancy had a question. What if the rider uses a walker and needs help to from the doorstep? So great question, Nancy. We see that happening quite a bit. From the Uber perspective, if they have a foldable walker, foldable wheelchair that will fit in a standard sedan, that will fit in the car, our drivers will accommodate, and they can help put that into the vehicle. And then we also have that Uber Assist product where our drivers do have training and can do door-to-door. Next question for KM. What payers is Uber currently partnered with? So KM, we are partnered with many is the short answer. We actually just announced this week a partnership with Humana on a few different initiatives that we're very proud about. And then I'll let Mike address some of the payers that ALC works with, but there's dozens, if not more, that are using our solutions. And then real quick, last question here. How do you handle riders who bring along a family member, i.e. spouse, who also requires some assistance? And that question comes from Lori. So there is no additional cost for more people in an Uber. So if they are with a family member, caretaker, caregiver, they can always accompany them, again, at no additional cost for more people in the vehicle. And then if they do require some care as well, remember, going back to some of those great product features that Matt addressed earlier, you can message the driver and actually let them know some of these things that they should be aware of. There are going to be two people coming into your car. They might need a little additional assistance. Just want to give you a heads up on that. So, great way to communicate with the driver. Mike, I'll pass it to you. Feel free to address any of those or keep going.
Yeah, thanks, Dan. So yeah, we do contract with, national managed care organizations, regional and local ones as well. Matter of fact, I think we started our first Medicare Advantage transportation program about 15 years ago. And it was for a special needs type population, a couple of them actually, like ESRD and congestive heart. So great question. And in regards to additional riders as well, on the American Logistics side, when we're managing the transportation benefit, those are some of the actual protocols that we have to get from our clients before we start transportation. How many additional passengers does the plan allow? Medicaid, for example, might be more strict compared to a Medicare Advantage plan. So great questions as well. Continuing on in the slides, we all live in a customer or a client-centric environment. And, with our years of experience and mountains of data, we can actually help our healthcare clients not just add a transportation benefit, but actually design it for the specific population under their care. Whether it be a basic Medicare Advantage plan or to a targeted, end-stage renal disease population with super unique needs, we can help with the program design, utilization models, and talk about budgets as well, and pretty much make any type of program work together. Next slide. When most of us, when we think of design, in general, sometimes we think of like web design or interior design. But when it comes to the design of a transportation benefit to a specific population, it also means the rules, the policies, procedures, technology, utilization of brand assets, and the overall member experience. Next slide. And, just to give you a quick example, right now we currently manage transportation benefits for several plans that incorporate an unlimited ride count to specific locations or providers, 24 annual trips to all the in-network medical providers, and 12 annual social determinant of health trips with multiple approved trip reasons. All three of these ride categories within a single plan. So the design flexibility of the actual transportation benefit it can serve a lot of different unique needs, and we can help, plan for that and manage it and get it going. Next slide. Leveraging the strength of your current brand and your brand assets is actually pretty simple with American Logistics. We've recently deployed our 3rd generation web portal, and it provides our clients, their staff, and any authorized medical provider partners with the appropriate view of the transportation management platform. This includes live trip tracking of all the rides regardless of mode. And we also have member mobile apps that are available, and our clients can decide which populations or user groups have access to the specific functions, including the scheduling and tracking of all the rides regardless of the mode. Next slide.
Mike, I'm going to pause you for a second too. Continue to get some really good questions here. Tackle one right now from Nancy Hall. Can a senior order the same driver so they can build trust and comfort with the ride? It can be scary to ride with someone they don't know for the oldest seniors. Absolutely agree, 100%. I think, an example of my grandmother taking away the car keys is one of the hardest, or one of the most hardest conversations you can have. And then on top of that, asking them to get into a car with a stranger really amplifies that challenge. So a couple of things there. We actually are working on features exactly like what you described there, where in the future we do see the ability to schedule or book with the same driver. That said, we can monitor the platform. And one of the great things about Uber and Uber Health, we get continuous feedback about our drivers. So if a senior does have a bad experience with a driver, we can make sure your healthcare organization never gets matched to that driver again. And the thing I would note is once we start limiting the drivers and limiting it to a driver, it's hard to ensure a guarantee that driver is going to be available when that senior might need that ride. So, we are trying to approach this from a few different angles, but we understand the importance of that question. I don't know, Mike, if you feel free to add anything there if you'd like on your side.
Yeah, no, I will, Dan. You mentioned the ability to screen drivers, if they might not be up to speed for these types of trips. And we're super appreciative of that. We actually have the capability to do it on our side and then through Uber Health. But the fact of the matter is, it rarely happens. It's rarely needed. On the request of a member requesting a driver, the same driver over and over again, that's one of the protocols that we would address with the health plan before we start to manage their benefit. And in those cases, we would probably end up using one of our local non-emergency medical transportation providers in our network that would be able to accommodate that type of service. And that is a possibility. It happens. And again, it would be more up to the health plan rules or protocols on our side. But great question. So just the last couple slides here. We have an API approach. We think it's pretty powerful when our healthcare clients can be able to actively manage their brand representation and values by utilizing the American Logistics API solution. This enables all of our clients to frame up all of the desired transportation management functionality into their own internal systems, sites, and apps. And you leverage the American Logistics functionality with an API first approach to transportation. And together we can actually divvy up responsibilities of managing the transportation benefit, whether it be Medicaid, Medicare Advantage, or even just a hospital facility. And that API approach is pretty powerful. So next slide.
Mike, specific question for you real quick, coming in from Patrick. Who manages the billing claims process for the existing transportation partners and payers?
Yeah, so when American Logistics contracts with a managed care organization, we offer all of that. We can do everything, a full turnkey solutions. We do have a handful of partners, if you will, where we can divvy up those responsibilities. But in general, we offer a full turnkey solution, including that functionality. And the last slide here is with this API first approach, new and powerful member experiences are 100% in our client's control. You can imagine your member on your website or in your care center scheduling their next specialist visit, and at the same time, they can book a ride to that appointment and the will call return to get back home. And it's just some of the functionality that we enable our clients to use through that API, basically giving you access to all the transportation benefit management tools that we have in-house to run internally, with our partners. So I think, Dan, that's it on all the slides on my side, and I'll turn it back over to you. If there's any other questions, that'd be great.
Yeah, so I'm gonna stop sharing my screen. Hopefully I didn't do anything I was supposed to do. So I think there's a couple other quick questions I can take. The one question from Adelie, and I apologize again if I'm pronouncing that wrong. Are there any plans for Uber Health to get into material management? And I guess that the term material management can be taken a few different ways, but if you're asking about moving things beyond just people, we absolutely believe there's a lot we can do there. I mentioned earlier, we have a meal delivery platform. Many Medicare Advantage plans are actually now incorporating meal and grocery delivery. So we're doing some interesting stuff on that front. We have a world-class courier network as well, one of the largest. So when we think about things like DME, pharmaceutical products, over-the-counter products, it is something that we're absolutely thinking about. And then Yogesh asked the question, thoughts, strategy on how increasing telehealth services impact non-emergency medical transportation and ultimately demand for healthcare rideshare platforms. Mike, do you have any thoughts on telehealth? And I'm happy to take it too, but I don't know if you have anything you want to say.
No, yeah, Dan, you can take that one. I've heard you before.
Yeah, so obviously telehealth is growing, especially in this environment we're in. Teledoc, doctors on demand. I mean, there's a lot of platforms out there. What we've seen is, and we've done some early work with some of them, there's still a need to potentially get a clinician to the patient, get the patient to go to a follow-on appointment, even get that patient to a pharmacy to pick up their drugs or go to physical therapy. And transportation is still core to a lot of those things that I just mentioned. So, I think there is some great synergy there. And then last question here we'll take in the last minute from KM. Is the booking platform on payer, portal, or provider offered to, is there a patient portal, I guess is the question. I don't know, Mike, do you want to take that?
Yeah, sure. Absolutely. So, we have a portal, secure portal that would be branded for our client. And that could include a web portal or the member mobile app. And our health plan partner will decide who has access to that. So it could just be their case managers, their member services, or they could give access to the members, certain family members to book trips in behalf, or medical provider partners. So basically our partner health plans decide who has access to those different technologies and who's authorized to use those functions, whether it be scheduling trips or just monitoring trips in real time. We can narrow that down to specific groups and specific functionality based on our clients' wishes.
Awesome. Thanks, Mike. And I think we're pretty much at time. I think on behalf of the American Logistics team, on behalf of Matt and our talented team of engineers and product folks at Uber and Uber Health, I want to thank everybody for making the time and taking some time away from this crazy world we're in right now. But we're very thankful for all of you joining us. I hope you can see we're very passionate about the work that we do. And certainly feel free to follow up with us through LinkedIn or my email. It's just my last name at Uber. And I don't know, Mike, do you want to provide your email?
Yeah, it's just mdunne, DUNNE at americanlogistics.com. And yeah, thanks. Like Dan said, thank you very much, everybody, for participating.
Great. Thanks, everybody. And thanks to the Northern California chapter at HIMSS for having us. Be well, stay safe, and stay home if you can. Take care.
Thank you.